Now we're getting rolling. My name is Jill Dehlin, and I am a registered nurse. Sorry, I accidentally started this on my personal Facebook page. Now I'm getting started doing the presentation on the Move Against Migraine page. My name is Jill Dehlin. I'm a registered nurse and a certified health education specialist. It's nice to be with you tonight. I am going to be talking with you about seasonal affective disorder. This is something that I thought would be a great topic for the month of January. I start using my own Happy Light about after Thanksgiving or between Thanksgiving and Halloween. And I found that it really helps me. And I thought that perhaps there would be other people in the migraine information about seasonal affective disorder and how to treat it, some of the causes, etc. So with that, I will get started. My learning objectives today are to talk about the causes, the symptoms, and treatments for seasonal affective disorder, and to talk about how this seasonal affective disorder impacts people with migraine. I then will help you figure out your own action plan. Hello, everyone. I'm reading your comments. I'm happy to answer any questions that you have. I want you to keep in mind that there is a bit of lag time between the time that I speak and the time that I can see your messages. So pardon me for any kind of pausing that I may take during this presentation. Okay, I'm seeing that Dawn Smith Hurley works for Dr. Vincent Martin, a migraine specialist in Ohio. Hi. Mary McSell is watching with her 8-year-old who gets migraines. I'm so sorry about your 8-year-old. I hope he or she is able to get some great information about this. And Margie, I am also a sufferer of severe migraines and seasonal affective disorder. So hopefully some of this information that I'm going to give to you today will be of some help. So, what is it? Seasonal affective disorder is a seasonal depression that usually hits people around the winter months. And in the northern hemisphere, that is anywhere from October until about March. And research has shown that the primary time that people have symptoms of seasonal affective disorder is in January and February. It affects about 5% of adults, and it can last up to 40% of the year. It's more common in women. Now, there are some people who have seasonal affective disorder in the summer months, but I'm just going to focus my talk today on the winter months. Again, for those of you just joining me, my name is Jill Dehlin. I'm a registered nurse and a certified health education specialist. I am a patient advocate and I'm a moderator on the Move Against Migraine site. And so I'm moving along. Just to let you know, I did a PowerPoint presentation because it helps me keep organized, and because I think many people like to not only hear what's being taught but see what's being taught. It's helpful for people to have both modes of communication. So here we go. Seasonal depression is what seasonal affective disorder is. And not only is it more common in women, it is also common with people with migraine. I'm reading Kara Lee, having migraine since your teens and gotten worse, and she has SAD too, and fibro. And thank you for appreciating the visuals. I gave the visuals to the Move Against Migraine crew, so hopefully they will be available for you. So some of the causes are lack of exposure to light. And I live in Michigan. I'm near the 45th parallel. So not only do I live in a state that is particularly cloudy because of lake effect, when the water from the lake rises up, it creates clouds, and the clouds move over Michigan. So we are faced with many cloudy days. And we are also at about the 45th parallel. So it makes things pretty dark up here in Michigan for a lot of people. So lack of exposure to light is the primary cause. It is linked to a decrease in serotonin, and these seasonal changes can also change your normal melatonin levels. Someone asked me between Parkinson's and the migraine, and I'm not a neurologist. I'm a registered nurse, so unfortunately that's something that I don't know much about. Fritz Hubacher mentioned that vitamin D may be related. Yes, that's correct. I get my vitamin D levels checked every year when I have my annual physical with my doctor, and I am on vitamin D supplementation. I'm sorry, Kara, that you can't see the video. Everybody else can see the video, though, I think. Penny Lou Ross Bonnert has migraine since age 8, now age 52. And she has a comment about the medications that she's choosing to use, and that nothing is helping her so far. Okay, so the symptoms of seasonal affective disorder are similar to depression. They include a depressed mood, oversleeping, low energy, fatigue, craving carbs, weight gain. Raise your hand if you've had any of these so far. Give me a thumbs up if you have had these things. Trouble concentrating, a lack of interest in normal activities, and this includes sex. And then sometimes people feel like they're socially withdrawn. Oh, look at all those thumbs going up. Very socially withdrawn, and they have feelings of worthlessness or guilt feelings. Sometimes it even goes as far as people having suicidal thoughts. And I want to let all of you know who may be having thoughts of ending your life that each one of you is so important, and the world could not bear to be without you. If you're having suicidal thoughts, I want you to make sure that you let someone know. If you're thinking of ending your life, you need to call 911 or a helpline for suicide, a hotline, and get some help for that, because these are not normal thoughts. We need you. So how do you treat it? Light. And there are also some other things that we can do, like cognitive behavioral therapy and different kinds of medications, including SSRIs and melatonin supplements. Natural light therapy is a good place to start if you're having some of those symptoms. So what you can do is expose yourself to light every day. And this can be as something as simple as sitting in a sunny window, acting like a cat in the sun, going for a walk. Getting out with friends and walking is a great thing to do. Plus, exercise has shown just walking has shown to help with people who have migraine as well. And it's great for us. Use sunglasses if you need to. If you're really sensitive to light, that's called photophobia. You can use special sunglasses called FL41 lens, with sunglasses with FL41 lenses. And two manufacturers I know of that make these glasses are Axon Optics and Theraspecs. The other thing that you can try is artificial light therapy, and this is something that people with seasonal affective disorder can use to help them when they don't have natural light available to them. Like I said in the beginning, there are lots of light sources that you can buy online on Amazon. I looked, and eBay, and depending on the size of the light, they can run from $32 up to over $100. But the average price was about $50. The best time of day to use a happy light is when you first get up. And what I do in the morning is, just like this guy sitting here reading a book, I set the light to my side and read the newspaper. And generally, by the time I'm done reading the newspaper, my 20 minutes are up. So you want to do this in the morning, first thing, because if you do it later on, it can disrupt your sleep cycle. So make sure that you're using this at the right time. You don't want to stare directly into the light, especially if you have photophobia. This may trigger a migraine. And if you need to, wear sunglasses while you're using the light. As I mentioned, you need to put it off to the side, use it in the morning hours to avoid sleep disruption. And what I found really interesting is that if you have bipolar disorder, or if you are prone to mood swings, that using a happy light may cause a manic or hypomanic episode. So be very careful with the use of light therapy. Another thing that I did read in preparation for this presentation was that tanning beds or booths are not recommended as light sources, and I think primarily because of the danger of skin damage. I'm looking at the comments to see if what else is here, scrolling down. And still reading. So one comment that I think is very important that the American Migraine Foundation made is that many people living with migraine also have depression and anxiety, and those are two of the symptoms of seasonal affective disorder. So you should speak with your doctor immediately to find some solutions for you, especially if you're thinking of harming yourself. And then they posted some resources for us there. So thank you for doing that, Erin. Okay. Cupcakery said that the light is better. I'm glad to hear that. And Lauren, a nurse practitioner from a headache center in Pittsburgh, is excited to learn about this and how it relates to migraine. And another message to a user, Cara Lee Carty Whitehead, who's having some really serious problems right now. And I want to let Cara know that she is not alone. We are a tribe here at Move Against Migraine, and we support each other. And I want you to know that even though things seem bleak right now for you, it's bound to get better. And we want you to talk to somebody about the issues that you're having. Okay, differentiate the difference between a migraine and cluster. I'm not really clear on what a cluster migraine is, John. We've gone over this a bit on the Move Against Migraine site. And some doctors do diagnose people with cluster migraine, but it is not a term that is on the International Classification of Headache Disorders list. So I'm not sure exactly what that is. You might want to take a look at the information that we have on the American Migraine Foundation about cluster headache and see if those symptoms have any resonance with you at all. So thank you for that again. And I will continue with the presentation. So what is cognitive behavioral therapy? Is something that's used quite a bit for people with anxiety and depression disorders, and it is very helpful. It helps to get people on the right track, to banish those catastrophic thoughts that you may be having. It is done with a therapist, a licensed therapist, and they help you to identify and evaluate the behaviors that you may be having that are perpetuating these feelings of anxiousness and depression. And then they will help you learn to replace your negative thoughts with constructive actions and ideas. Negative self-talk is a big issue with people who have seasonal affective disorder and depression and migraine, because it's really easy to get down on yourself when you're not able to function as you normally have in the past. It's upsetting, it's depressing, and I understand those feelings. I've had them. I have them. I had a migraine today, and I worried about being able to function well enough to do this talk. So these are common issues, and even though you may feel that you are alone, working with a therapist may really help you to sort out these feelings and help get you on the right track. The other thing that I wanted to mention was that something my dad used to call the woulda, coulda, shouldas. When you think, well, she should have said this, or I could have done that, or you just perseverate or go over and over the different things that you regret and you have guilt feelings about. And don't should on yourself. You're an important person, and I want you to think that everybody makes these mistakes, and just pick up and move on. And if you're not able to move on, then it's time to talk to somebody. And if you can't see a therapist, talk to a friend or join the Move Again Migraines support group, and we will do our best to help you out. Again, if you're having thoughts of ending your life, we want you to get help as soon as you can. I'm reading again the comments. Ophthalmic migraines, and haven't found much info on these. I'm not that familiar with ophthalmic migraines. A friend of mine says that she has ophthalmic migraines. Melissa, do your ophthalmic migraines present themselves as aura symptoms? Because that's what my girlfriend finds that she has. Again, the American Migraine Foundation is a great source for information. Taken different meds and nothing seems to help. Need other things that I can do at home other than sleep and cold showers. Again, there's a lot of information on the American Migraine Foundation, and there's also a great source with my friends Terry Robert and Tammy Rome, our authors on this site called healthcentral.com/migraines. And you can do great searches for lots of information about current medicines, and maybe you will get some ideas. The other thing that I would suggest to you is that if you are not seeing a certified headache specialist or a neurologist, that this is something that you should consider. And there is a search tool on the American Migraine Foundation site that you can use to help you find a certified headache specialist. Okay. Keeping going. Same with me. Glad to see men on here. Had migraines for a long time. Botox treatment. Botox treatment is a wonderful therapy. It works for some of the time for some people, and all of the time for some people, and none of the time for some people. And I've been in all three categories, so I am not currently getting Botox because I have not found that it's helping me right at this point. And I agree, Michelle Feely, I wish people so much more than a bad headache. And I think what you need to talk about when you're discussing your migraine disease with people is to call it a migraine attack. And as my good friend Dr. Amal Starling says, if you have epilepsy, you don't say, I have epilepsies. You say, I'm having an epileptic attack or an asthma attack. And when you change the language that you use to describe your migraine, you can also change people's perception about its severity. Number one migraine trigger is weather changes. Oh, I'm so sorry. Had them for a year. Sabrina and Michelle. Yeah, you're welcome. Despite my migraine earlier, I will carry on. That's what we do, right? We push forward. That's what we do. I get a terrible pain at the back of my head. Marcy Sandra. Sometimes I know I'm here to talk about seasonal affective disorder, but I want to discuss some of your questions as well. Marcy has a question about pain in her occiput, which is the back of her head, and her neck. And there's a kind of headache syndrome called cervicogenic headache. And this is also something that I have. And the way it's treated is with massage, with warm or cold packs, whichever feels best for you. You can also see a pain specialist, and he or she can do injections of a steroid in your neck to see if that helps. If these steroid injections help, there are also procedures that will actually send a radio frequency signal to the nerve to ablate or singe it just a little bit, which will deaden that pain signal that goes from your neck up to your head. Okay? Thank you, Susan Beasley, for putting the suicide crisis line down. It's 1-800-273-8255. That's 800-273-8255. Tara is fighting for SSDI. They say that she doesn't qualify with just migraines. I know a lot of people who have qualified for Social Security disability with just migraines. And maybe it's time for you to talk to an attorney who can help you navigate through some of these issues. You could also post this topic up on the Move Against Migraine site to pick other people's brains to see if they have any other ideas on what you can do. Deanna is recommending a sleep study, and actually there is a great correlation between sleep apnea and migraine. I recently had a sleep study done, and I found out that I have moderate sleep apnea, so this is something that I am willing to try to see if it helps. So thank you for mentioning that, Deanna Reeves. And there's the link to find a doctor. Dealing with a bad, sorry, Andy, that you're dealing with a bad migraine right now. So Sarah, I would be happy to continue to focus on SAD. Yes, I am getting a little bit off track, and I apologize for that. I wanted to make sure that I addressed some of these comments on things that I'm familiar with. And no, you're not rude. Okay, the medications that can be used for seasonal affective disorder are selective serotonin reuptake inhibitors, also known as SSRIs. These are antidepressants such as Wellbutrin and Prozac that can help boost your serotonin levels. And these are by prescription, and you need to get a prescription from your physician. Another thing that you could try is melatonin. And melatonin is something that is helpful for migraine disease, regardless if you have seasonal affective disorder. I take mine 2 hours before bedtime, and the dosage is usually between 3 and 12 milligrams per night. The supplement that I found, I got at Costco. It's made by a company named Schiff. I'm not promoting it, but I'm just telling you what it is I use because it also has valerian root in it. And I found that this particular supplement that I get at Costco is more effective for me. But again, you should talk to your doctor before starting any kind of herbal supplement. The next thing that I would recommend is to make a migraine-friendly plan. So if you're not able to work, or if you're not working, or if you are working part-time because of your migraine, create a daily schedule and include a daily exercise plan in that schedule. Some time that you can spend outside in the sunlight, or even just outside walking in the fresh air can help. And make sure that you're getting enough sleep. Not too much sleep, but enough sleep, because too much sleep and not enough sleep can also trigger a migraine. Increase your exposure to light and wear sunglasses, including those FL41 special FL41 lenses sunglasses if you have severe photophobia. If you use artificial light therapy, use it in the morning, not later on. Within the first hour of waking is the best time. And don't look directly at the light, because this can be a trigger for you. Other helpful habits that you can try is to get regular exercise. Pay attention to your eating. If you notice that you're eating a lot of carbs, then try to rein that in and see if you can eat something that's a little bit less carb rich and more protein rich. Stay active and socially connected. The picture that I have on my slide is a group of women that are getting together to exercise outside and walk. And I think that's a great way to spend 30 minutes or so with friends that you can talk to about the issues that you're having, or just to get out and blow off some steam. You can also get help from a physician or a licensed therapist to rule out any other causes of these depressive feelings that you're having, including hypothyroid, low blood sugar, mononucleosis, or other kinds of viral infections that can sometimes cause these symptoms. A licensed therapist is of great help. And I think by and large there's so much stigma for people to seek help from a therapist. And I like to think of it as getting your mental health checkup, just as you get your yearly physical, a yearly mental health checkup is not a bad idea, even if you're feeling mentally healthy. I'm reading some of the comments. And weather changes are a big trigger for people. Vitamin B12 is something that Sarah Shermack-Lee Lowy has recommended. B12 and vitamin D. These are supplements that are often taken by people with migraine, in addition to magnesium. And I'm reading. One person posted that she did call a crisis line today, and good for you. I think that's a brave step. And it's, I lost a dear friend to suicide just a month ago, and it still tears me apart. And the people that are left behind always wonder if there's something that they could have done to help that person before they ended their life. So I applaud you for taking that brave step and ask for help. So that is it for my presentation. These are the references that I used for my talk today. I got information on seasonal affective disorder from the American Psychiatric Association, the Mayo Clinic, and the National Alliance of Mental Disorders. So I thank you for joining me. My 30 minutes is up, and I hope that you keep working on finding a treatment for your migraine disease. Don't give up hope. There are lots of treatments out there, and new treatments are on the horizon. I want you all to know that this disease will not conquer us. We are going to conquer it. And on that note, I will say good night. Good night.